Hello, everyone, and thank you for joining us. My name is Jennifer Larson, and I am the training coordinator for the Office of Community Living. I will just go through a few housekeeping reminders. We are recording with the intent of posting this recording on our website, so please be cognizant of sharing any personal or protected health information, either verbally or in the chat. Our team will be managing questions in the chat panel, so please type those in as you have them. A copy of today's slides are available on our website, and we will add a link to those in the chat so that you can go there and download them. If you are listening by phone only and not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand to be added to the queue. And Zoom does provide closed captioning. If you click on the live transcript or CC button at the bottom of your screen, you can turn that either on or off. And with that, I will turn it over to Haley to start the presentation.
Good afternoon, everyone. Thank you so much for joining us. I'm Haley Gleason. I am the Division Director for the Strategic Outcomes Division within the Office of Community Living, and I am thrilled to have you all here for our quarterly webinar. Today, we are going to be providing some updates and information on where we are in the implementation of the American Rescue Plan Act funds that HCBS has received. We'll primarily be focusing on our home and community-based services funds, that's section 9817 of ARPA, but we do have a couple of other updates on some other funding sources, so we're excited to share those with you today. Next slide, please, Jen. Here's a bit of an overview of the agenda for what we'll be covering today. We'll kick it off by just doing some general updates, give you a sense of where we are in our spending progress on our HCBS spending plan. We'll talk about a project that has closed, our very first one, so we're pretty excited about that. And then Max is going to join us and do a bit of a demo of some changes to our website. That's really been our source of information for our stakeholders. And we've made some changes and improvements and want to make sure that you are aware and sort of understand how to navigate through. We're going to spend quite a bit of time talking about our grant programs. We know those are of particular interest to our stakeholders. So we'll be covering sort of where we are in terms of the rollout of those grant programs. We will be talking about the grant programs that are currently open and available. We're excited to have a guest speaker today. Christy Broughton will be joining us from the Developmental Disabilities Resource Center to share a little bit about her experience receiving one of our grants. And then we'll also have some guest speakers from the Office of eHealth Innovation to talk about their grant program. So really a robust section talking about all of our grant efforts underway. And then finally, we'll close with just some general updates. We have some updates around our Community First Choice project, as well as our Department of Justice rollout and a couple of other upcoming stakeholder engagement opportunities. So a full agenda, and I will get us started. So next slide, please. Oh, I did want to mention that we, throughout the webinar today, we do have some polls that we'll be posting. We encourage you to participate. We're always looking for feedback and suggestions from our stakeholder participants to understand how we can improve. You know, are there particular things that you are wanting to hear more about? Are there different formats that you want to be sure that we know about in terms of sharing information? So we have a couple of polls related to our webinar, our website, as well as our newsletter. And those will be popping up throughout. I'll talk you through how to respond to those, but are asking you to participate so that we can get that feedback from you. So just a heads up that those are on the way. Next slide. Next slide, Jen. All right, well, we're gonna start off with the money. So we will tell you where we're at in our spending progress. As I'm sure you'll all remember that our ARPA HCBS spending plan includes a budget of $553.2 million total, spread across 63 different projects, all at different phases in terms of implementation, but well on their way to spend by the December 2024 deadline. You can see that at this point, our estimated amount spent to date is $104.38 million. And then we do have another 203 that is either encumbered or allocated. So those are funds either, you can see the first line is spending plan projects excluding rate increases. So those are things like our grants or our contracts. So about 59 million in that bucket that we have encumbered, and then 144 million that are expected expenditures related to our rate increases that are still coming. So those are what we know will be spent but have not yet been spent. So in total, that's about 307 million or 56% of our total budget. So considering we're about halfway through in terms of our timeline and about halfway through in terms of our spend, we feel like we're on a pretty good track to get us where we need to be by December of 2024. Okay, next slide. Just wanted to flag for all of you that we have recently posted our latest quarterly reports up on our ARPA website. As a reminder, we are required to submit quarterly reports to both CMS and the Joint Budget Committee. They're on a little bit of a different timeline, so you'll see that the Joint Budget Committee report was submitted April 17th, whereas, those are actually switched. The report to CMS was submitted on April 17th, and the report to the Joint Budget Committee was submitted on May 1st. You'll see they're a little bit different, but if you look at one, you'll get the information you need. They're similar enough that you don't need to review them both. And then we also do have a PDF of our budget and spending report, which will include all of the projects and details on their budgets as well as their spending to date. So that those quarterly reports are from January through March. So they'll report on the activity during that time frame. And again, they're available now for you to go and take a look. Our next reports will be submitted in July. So they are not too far away for those next reports to come around, but those are really a wealth of information. So I do encourage you to take a look. Next slide. Oh, and I see Amanda's come off mute. We are again very excited that we have completed our first of many ARPA projects. So we have our 5.03 case management rates project, which has wrapped up and closed. And so Amanda's going to talk us through what that project has accomplished.
Great. Thanks, Haley. Good afternoon, everyone. And can we first just say, oh my gosh, how is it almost July? Where has the time gone? Secondly, just wahoo, right? To accomplish one of the ARPA projects and have it completed is very exciting. But even more so than that, just the extraordinary work that went into collaboration with our case management agencies and our contractor and department staff on really two prongs to this project. The first one was with case management redesign, we are implementing the future state of case management where one entity will serve all individuals regardless of what waiver programs they receive. And today we pay differently for all of the activities and it looks different. And so we need to have a rate methodology that is really future facing and has a singular rate for all of the activities, regardless of which waiver program or which entity is providing that. So our vendor started work in December of 2021, and it resulted in a comprehensive rate workbook that the department will use moving forward when developing rates or making changes to our rates for all case management activities. And so we conducted a time study with our case management agencies about this time last year. It was a significant lift for everybody to provide feedback and input and track the hours each different case management activity demanded on their staff and time and resources. And then that analysis then took several months for the department staff and the vendors to then be able to create the comprehensive workbook with different levers and modules that we can use going forward. The second piece on the next slide of this project that was very exciting was really to evaluate and identify best practices in case management and provide recommendations to the department. This included the interviews that were conducted with our case management agency partners and other stakeholders, but also looked across the country at best practices to really see if we are transforming our case management system and how we pay for services. What are some of those innovative ways that we can really leverage to, I think, incentivize high quality and the ability to really be hands-on and person-centered. So they made recommendations to the department, and we are continuously working on those, and some of them we actually have implemented or will be implementing. And so the first one is caseload sizes. We will have a requirement with the new contracts for all case management agencies to have a 1 to 65 member caseload size, so that we can really make sure that case managers have the ability to be able to spend the time with each individual member to meet their needs. Now, this doesn't preclude a case management agency to make business decisions or structure their programs in a way that might exceed that, or depending on what's best for the individuals in the community in which they serve. So they can propose to the department changes to that. It has to be approved prior to that. We are also looking at streamlining our comprehensive training. And so this was a very big one as we were doing stakeholder engagement on case management redesign, to ensure that we have a much more sophisticated training program and that it's tracked and monitored in a much more cohesive way. So we will be implementing a learning management system with new curriculum being developed by another ARPA project, which is 505. The third recommendation that they had was really to review our rates on a more regular cadence. Their recommendation was every 5 years or sooner, and that is something the department will move forward with. The next one was alignment of case management tasks across all of our programs and services. And this is our goal to do this. However, it will take us a little bit longer over time, over the next probably 2 years, to really align 100% of our programs, just because of the different federal authorities and approvals that we're working through. But it is our intention that case management requirements would be cohesive and consistent across all of our programs. The last one is really to include increasing our quality oversight and our measures to make sure that we're achieving high quality services, and doing that through a statistically valid sample size. So historically, the department has taken all of our waiver programs and run our quality measures based on the total population. We will be moving forward with each catchment area that is served by case management agencies, and each individual waiver program will have its own statistically relevant sample size. That's a hard one to say in the afternoon. So we think that will deliver to us a much better insight into how our programs and services are. So high level, that's where we're at. And with the passage of signing the long bill, we were very grateful for our joint budget committee to approve the new per member per month rate that we will be using for targeted case management as part of case management redesign as a result of this project. So thanks, Haley.
Thank you so much, Amanda. Again, very excited to have our first project complete, but obviously expect to hear a lot more of these in the coming months as we start to see projects wrapping up. Next slide, please. So I'm actually going to turn it over to Max, and we're going to, I think, pull down the PowerPoint and bring up our ARPA HCBS website, and he's going to do a little walkthrough of what has been updated recently. Go ahead, Max.
Great, thank you, Haley. It's nice to see everybody. So many of you are probably familiar with the website that we maintain specific to all the work that we're doing in these projects. We have been using it for a number of different channels of updates, including our newsletter, our webinars. We post all the recordings and the slide decks from these webinars, in addition to documents that we post, like the reports that Haley mentioned earlier. But the thing I wanted to demo today is our project directory in particular. So you'll see on the homepage over on the left, we have our project directory menu. And in this table, we have a list of all the projects. Each of these links goes directly to a section of the website that will give a summary of the project itself when the project's launched. And beginning now, we're going to start adding in some visual cues that show you when projects have been completed. So specifically, the status column that you see on the right will continue to be updated as more and more projects begin to close. So the vast majority are going to be active status at this point. But if we scroll down to the case management rates project that Amanda was just talking about, you'll see that we have a new visual cue of this green checkbox with the word completed. So as we add more projects to the completed list, you can come to this page. You can quickly, in this search bar, for example, just type the word completed, and it will filter the list of all of the projects to just those that have been completed when you do that. So a nice little trick that you guys can use to keep track of all of the work that's being done and completed under ARPA. So once we go into that project description, I'll click on that link for case management rates. It'll take us to another page where we're going to begin posting some kind of wrap-up information. So we preserved that same visual cue on this part of the website. So as you're looking through these various pages, you'll see this as well. We're going to be listing the date that the project's completed, some key project activities or achievements, kind of looking backward, and then link to any relevant documents or kind of work product that came out of these projects for stakeholders or other interested parties. So I encourage you all to maybe bookmark the project directory page, which again, you can find on the left sidebar. It's organized by the different buckets of work that we're doing, the categories that the projects fall within. So we're really hoping to make this section of the website a focus moving forward. So if you have any questions or suggestions, you're always welcome to reach out to us directly using the HCBS, HCPUF HCBS questions email inbox, which you'll see on a slide later in the presentation. And we'd love to hear your feedback or suggestions, or if you notice any flaws, please let us know. So I will stop sharing and hand it back to Haley.
Thank you so much, Max. It's often helpful to just sort of see it versus talk about it. So, you know, I know that the team has put in a lot of work to make sure that that website is a useful tool. So I'm hopeful that the changes will only allow you to further navigate and find what you're looking for, and then very quickly and easily get to the, like he was saying, the information you need, particularly around these completed projects. Next slide. So that actually leads us to our first poll. So since we were talking about the website, we wanted to get some feedback about the website and would love to hear first, what is your favorite content? What is your favorite content that you find on the ARPA webpage? So if you can throw in an answer to that, that would be really helpful so that we know exactly what you're looking for. You know, what is it that you're using on the website? Because that will tell us what we should do more of. And then the second question is, what additional content would you like to see posted online related to the ARPA project? So is there anything that's missing? Anything that you feel like should be added to the website that you're not seeing now? So I'll just give you a minute. The poll should have popped up on your screen so that you could quickly answer and throw in your thoughts there. And again, that's just really helpful for us so that we're able to continue to improve and make that a useful site. All right, I'm still seeing responses come in, so I'm going to just give it a couple more seconds. All right, thank you so much to those of you that were able to respond. Okay, all right, I'm going to keep us moving. Next slide, please. Okay, so are there any questions or comments or discussion about what we've covered thus far? So about our spending to date, about the closed project, or even other questions about the case management efforts underway, or about our website and what Max reviewed. Pause and see if anyone has any questions. You can either take yourself off mute, you can raise your hand. To do that, you click on the reactions button at the bottom, and there's a hand raising button in there. If you're on the phone, you can press *6 to unmute or *9 to raise your hand. All right, not hearing anybody, I will keep us moving. Next slide, please. All right, we did just want to pause and recognize we have two months, themed months in May. And so we wanted to recognize those, particularly since these are populations that we serve and that many of our ARPA projects are hoping to improve services for. So first, it is Older Americans Month in May. And the theme this year is Aging Unabound. And that's something that ACL has come up with, and the goal of sort of presenting with that theme is really to encourage people to explore the diverse experiences and discuss how communities can combat stereotypes related to older adults. So, you know, this is obviously an important topic. We have currently 56 million people in the United States over the age of 65, and that number is going to grow to 71 million in 2030. We know that the older adult population is rapidly expanding, and you know, a big part of our ARPA HCBS effort is to ensure that we're meeting all everybody's needs, particularly our older adults who we want to be able to age in community and maintain their independence. So just wanted to highlight that that it's Older Americans Month, and also provide the website if you want to learn more, or if you want to access some of the resources. They have some really wonderful tools and posters, all sorts of things that you can use if that's something you want to share with your community. Next slide. So in addition to Older Americans Month, it is also Mental Health Awareness Month. So pretty important month, as I said, when we're thinking about the populations that we serve and all of our ARPA HCBS projects, and what they, you know, how they are targeting these particular populations in particular. So this is kind of an important month, I guess, for us. So Mental Health Awareness Month. This year's theme is More Than Enough. And this month serves as an opportunity for all of us to come together and remember the inherent value we each hold, no matter our diagnosis, appearance, socioeconomic status, background, or ability. So I think that's really a wonderful theme, and so important for us to take the time to really have the conversations and be talking about the stigmas associated with mental health, and making sure that we're all aware of again, the resources that are available, and you know, especially for us as we're working to improve our behavioral health and mental health services that are available in Colorado, particularly those that we are targeting through our ARPA HCBS projects. We're really excited about being able to expand access and services. So we've linked here NAMI.org, where you can also find out more about Mental Health Awareness Month, and again, can find a lot of wonderful resources if you'd like to share those with your network. All right, next slide, please. Okay, we're going to move on to talk a little bit about all of our many grant opportunities. We have had a number of grant programs that have already opened and closed and started awarding. So we wanted to give you a quick overview of where we are in the process of rolling out all of these grant programs. So I'm actually going to hand it over to Emily Reddick, who is our ARPA strategic manager, and she's going to give you an overview before handing it off to some of our particular grant programs to talk about where they are.
Thank you, Haley. Excuse me. I'm excited to share that we currently have $148 million dedicated across 21 grant programs that are pilots and community initiatives as well. Approximately $68 million of this funding has already been committed. $54 million in spending is underway through 140 signed grant agreements with our community partners, and 113 additional grant agreements are being signed as we speak that will allow for spending of an additional $13.5 million. And you'll hear more about that in this presentation today. That leaves approximately $80 million in spending in upcoming grants, pilots, and community initiatives. And you'll learn about some of those other open opportunities today as well. And with that, I will hand it over to Heather Johnson, HCBS Long-Term Direct Care Workforce Unit Supervisor for the Office of Community Living.
Thank you, Emily, and thanks for saying my title. I always appreciate saying it. If you want to go to the next slide, I will talk about 1.05. We have HCBS provider grants. So the goal of these grants are to provide training opportunities for direct care workers to gain higher level skills with the intention of promoting greater retention within the HCBS workforce. The maximum award for these grants per grant award is $100,000. We will certainly award anything up to that. If you're looking at a smaller project, we would be happy to look at that and see if we could support it. The eligibility for this is an HCBS provider, so currently enrolled as a provider, or a training vendor that is developing and or delivering this training to the HCBS workforce. We've had several agencies or vendors make the training statewide. We've had some training vendors apply for the grant with the intention of working with just a couple providers to deliver that. So really, we would love to consider whatever options might be applicable. Important to note, it is for higher level skills training. It cannot be that initial onboarding or annual training that you would require for your employees. The grant cycle will end on the end of this month. So May 31st, we have 2 additional grant cycles planned. So the next one will open up June 1st. On our website, we do have recordings of our informational webinars. If you'd like to view them before you apply, you're welcome to check those out. And additionally, we have another informational webinar coming up June 29th. There will be a link on the website for the request for application. We have an FAQ on there. Should give you a lot of information, and then also how to apply. You would need to just fill out the application. We have a budget worksheet in there to fill out, and it'll tell you what other documents you have to attach to your application. And if you have any questions about it, you're looking at it, you're filling it out, feel free to email us at the HCBS_DCW DCworkforce@state.co.us. We'll be happy to answer your questions or find an answer for you. We're really excited to get this money out the door, so we welcome as many applications as possible. So far, we've had 3 grant cycles complete with 29 awards and totaling $1,929,571.10. So we definitely have more money to spend, so please apply. And along with that, I would like to introduce Christy Broughton. She's the Senior Director of Waiver Services at Developmental Disability Resource Center. She applied for the grant for DDRC, and she's going to talk a little bit about her project and how she went with that process. So I'll hand it over to Christy.
Heather, thank you so much.
There is a slide. There we go. Thanks.
Thanks so much. So a highly competent and ethical direct support workforce that supports people with disabilities in achieving their life goals has been the goal of the National Alliance for Direct Support Professionals since its founding in 1996. In the decades since, NADSP has developed a set of nationally validated code of ethics and core competencies, shaped national policies and practices, and reached tens of thousands of direct support professionals through both individual and organizational memberships and through their DSP credentialing program. Developmental Disabilities Resource Center, an agency that supports people with intellectual and developmental disabilities across their lifespan, is using the funds we secured through this grant to initiate our engagement with the NADSP. We see this as a first phase in a multi-phase, multi-year project. In June, NADSP will be on site at our agency for 3 days of training. 2 of those days are dedicated to introductory training in the Code of Ethics and their core competencies for our direct support workforce, supervisors, our nursing team, and administrators, as well as a 1-day frontline supervisor train the trainer curriculum focused on developing our supervisory staff. And in October, NADSP will return for a second round of introductory training for informed decision-making, as well as delivering train the trainer curriculums on the Code of Ethics and informed decision-making. During the grant timeline, our goal is to train 40 direct support professionals, Code of Ethics and core competencies, 25 in informed decision-making, as well as 25 supervisory and administrative staff. Additionally, we plan to develop 10 staff as trainers for the Code of Ethics and informed decision-making, and 7 staff in the frontline supervisor training. Our unduplicated target number is 65 staff for an approximate investment of $921 per employee. Investing in these trainings, and in particular the train the trainer modules, we can further promote the Code of Ethics, informed decision-making, and the skill set for our frontline supervisors long-term, as well as further integrate these skills and principles across our agency. The next phase in our process will be to integrate the principles found in the Code of Ethics and core competencies and informed decision-making into our job descriptions, performance planning, and budget development process, with the ultimate goal to provide opportunities for our DSPs to participate in the credentialing program and receive financial incentives for each level of credentialing they achieve. And in doing so, we hope to foster support for professional development, further establish a clear foundation from which we operate, and to provide our staff with transferable value and skills as they develop and move along in their career. The process for applying for the grant was relatively painless given the rest of what all we do in our field. And it's been lovely to have the support and the back and forth of the team when there have been questions about the application we have, as well as getting support for the reimbursement for it. That's all I have on the grant, so I will turn it over to the next person. Haley, perhaps.
Thank you so much, Christy. Thank you for sharing about your program. It's really exciting, and this is exactly what we are hoping that others will do with these funds, and will take the opportunity to apply and implement trainings that really help our direct care workers to advance in their careers and give them those enhanced skills. And so thank you for coming and sharing about your program, and hopefully others can see it as a model and example for what they may be able to do with their staff. So I'm very excited to see where that goes.
Me too. Thank you so much.
All right, next slide, Jen. Great. So I am now going to turn it over to Rachel Shuck, who is a manager within the Behavioral Health Initiatives and Coverage Office here in the Department of Healthcare Policy and Financing. And she's going to give an update on the Healthcare Practice Transformation Grants. These grants were actually funded using state and local fiscal recovery funds. So you may have heard of SLRF or SLFRF. They are also funds through the American Rescue Plan Act, but a different source than our HCBS funds. But we wanted to give her an opportunity to come and share a little bit about where they are in their process of releasing these grant funds. Rachel, I'll turn it over to you. Rachel, I'm not hearing you. If you're trying to speak, you may need to try to unmute again. All right, well, I will jump in if Rachel... Oh, there you are. Oh, Roderick, are you going to take over?
I'll take over for her.
Okay, thank you. We're having some technical issues. Go ahead, Roderick.
All right, so hi, everyone. Just a little tidbit on what we're doing with this project. So we did release RFA, which is now closed. It closed in April 26th, with the anticipation of 150 sites applying for the grant. We did get 258 sites to apply for this grant, which we're excited about. Unfortunately, we had to make some decisions as far as like approving some of the grantees for this funding. So we are working through that. We should be finishing reviewing applications either the end of this week or early next week. And then we will start reviewing those and then reaching out to folks about their approval. Those funds will not be released until August, I'm sorry. But we were excited about folks who did apply for this grant. We did have a lot of, I say, rural areas and small practices apply for this. So we're excited about that. We definitely try to reach those hard-hit areas for around behavioral health. But yeah, so we're excited about this. Everything is closed up. We are working with a vendor as well to help review some applications and also work on billing and data process. So we want to make sure we work through that. We want to ensure that providers or practices are actually getting paid for the services they're providing. So we're working through that right now. We're meeting with other folks outside of HCBS to come up with some ideas around that.
Great, thanks, Roderick, for jumping in. Roderick is our division director within the Behavioral Health Initiatives and Coverage Office. So thanks for covering that. I think we do have another slide, Jen, which I believe Roderick has already pretty much covered. Here we go, the grant status. You can see, yeah, what he was talking about that we did. We were super excited to get so many applications. I think that just shows the need to really take this more integrated approach to physical and behavioral health. So lots of interest, but then that means tough decisions for our review team who have to, go through and decide which projects will get to move forward. So here's the dates in terms of announcements and when that funding will be distributed.
Great.
Anything else to add, Roderick?
No, that's it, but we will be updating obviously our website for any other information. We did hire a new communication and marketing specialist. And her name is Evan Hawaiian, and she'll be reaching out to some folks as well. So if there's any questions, I didn't see our email attached to this, but I will put that in the chat as well.
Great, thanks, Roderick. And we'll continue to keep people posted as these grantees are announced. All right, next slide. Okay, I am excited to have two staff members from the Office of eHealth Innovation here to talk about the 6.06 grant. Speaking of grants that had a lot of interest, this grant program had huge interest and a ton of applications. And so Amanda is here to give an update on the status of that. I'll hand it over to you, Amanda.
Hey everyone, Amanda Smith with the Office of eHealth Innovation. My colleague Sierra and I are really excited to tell you about the grant program as well as the outcomes of the first RFA phase 1 period. Provide some metrics and data on that, as well as our reach into the communities as a consequence of this grant program in Colorado. And finally, we'll share some information about next steps with regards to the Dollars to Digitize grant program. On the slide here, you'll see just a quick overview of what the grant program is all about. Essentially, it's to support HCBS and behavioral health providers by providing digital tools and technology to offer the most value to their members and their business. Essentially, the main outcome of the grant is to increase and enhance the use of electronic health records, whether that is adopting a new EHR or a paper conversion, or upgrading an existing EHR to be compatible, let's say, with the HIEs. The funding also goes to expand providers' reach to members by enhancing real-time data sharing capacity, referral tools. There's funding for telehealth systems as well as necessary devices for the providers to use, as well as to loan out to members so that they can equitably participate in their telehealth services. And to ensure success, we also wanted to carve out some funding within the grant to go towards technical assistance to help providers demonstrating need have additional support to help them be successful in implementing their digital transformation project. And I'll hand it off to Sierra with the next slide.
Hi, thanks everyone. So as you can see in this pie chart, of our 113 grantees, 83 were home and community-based providers. We have 27 who were behavioral health providers, and we have 3 who were community mental health centers. About 95% of our grantees are small businesses with less than 500 employees, and we estimate that for about 80% of them, this is their first time receiving a federal grant. We don't have exact numbers on this yet, but we will have them when we receive final contracts, many of which we've already received. We're excited that part of this ARPA 606 opportunity involves technical assistance and learning circles, so we have the ability to see these grantees through the process and help them be as successful as possible. I want to say that the average award amount here is $118,000, with the most requested technology category being EHRs and devices. With a total fall award amount of $13.5 million, we were able to support a large number of brand new EHRs, many of which were paper conversions, EHR upgrades, and devices to support telehealth and connectivity to these new systems. Next slide. So this map illustrates the locations and service types of the ARPA 6.06 grantees. Additionally, the counties are color-coded to represent the number of grantees serving each county, controlling for population. Of our grantees, about 74% are HCBS providers and 26% are behavioral health providers, and some of them are both. According to self-reported data by the grantees, we have at least 5 grantees serving populations in every single county in Colorado, with many of these counties being served by more than that. We see that many of our rural counties, especially in the Eastern Plains, are being impacted by telehealth offerings from our grantees, even if there's no physical service location in that county. And over a third of our grantees are receiving funds to bolster their telehealth services, many of them noting in their executive summary the specific purpose of extending their reach into rural areas with this technology. The addition of EHRs requested by most of our grantees, about 75%, adds a layer of connectivity and interoperability to these disparate populations that may now receive improved services from our grantees. So with that, I'm going to go ahead and pass it back to Amanda for some next steps on our program.
Thanks, Sierra. Yeah, super excited about the outcomes of the first RFA round of funding. We are planning another round of funding in the summer, and I'll get to that in just a minute. Just wanted to call out and reiterate what Sierra has shared. We are thrilled to see that of the fall 2022 RFA phase 1, we have exactly 85 EHR upgrades or new implementations with this funding, 41 telehealth systems with their devices to support their services. 17% of the funding did go to necessary devices, laptops, tablets, modems for connectivity, as well as for loaning to members. And we did have 6 HIE connection projects come through the narratives and approved with the grant, and 3 referral network tools, which we're really excited about that as well for care coordination. So the summer RFA, we anticipate will open the end of July or August. The dates aren't set in stone yet, but we're working as quickly as possible to get round 2 up and running. We do anticipate 200 plus applications. That's just an expectation. Reason being is that we actually have a new eligible provider type joining us for the round 2 of Dollars to Digitize, and that will be the CMAs who continue on outgoing as a CMA or a PASA. So they will be included just like all other HCBS providers in the grant program for devices, telehealth, EHR upgrades, technical assistance, etc. I did also want to note that the Dollars to Digitize program is also partnering with it's the CMA Startup Single Grant, where there's 3 grants that combine efforts for the new CMAs under the redesign. So we're partnering with the other grant programs to provide Dollars to Digitize funding for the CMAs to upgrade or implement an EHR as well, in addition to what we'll be launching this summer. And for more information, please check our website located here on the slides. For later this month, we hope to have some more definitive information on when we will be announcing the summer RFA. Thank you.
Thank you so much, Amanda and Sierra. Lots of exciting things happening with the Dollars to Digitize program. So next slide, Jen. So in addition to the upcoming second round of D2D, we have a couple of other grant programs that will be opening soon that we wanted to highlight for all of you. The first one is our Project 4.03 Child Youth Step Down Options Grant Project. There are going to be 2 requests for application tracks opening this summer. One will be focused on CHIRP expansion, and the other one will be focused on qualified residential treatment program research. So please keep an eye out for that if that's something that you think your organization might be interested in applying for. We also have Project 7.02. This is our Member Emergency Preparedness Grant Program. The goal of this grant program is to assist members with disabilities and those with mental health needs who live independently in the community to be prepared for potential emergencies by providing resources, supplies, or education. And the application is set to launch in July this summer. So that's going to be another great opportunity, particularly for our members, to be able to get the resources that they need in their independent home in the event that there are emergencies. And emergencies could be, fires, floods, pandemics, all sorts of things, and we want our members to feel prepared in their homes. So you've got Dollars to Digitize, you have these 2 that are upcoming. As Emily mentioned, we have a lot more in the works that will be posted soon. So we're really excited about all of these wonderful grant programs. Also just wanted to flag as a reminder, as Heather mentioned, we still have the training project grant available. So 1.05, that training fund, both for employers or training providers, there's a grant available for them to offer training to employees. And then there's also another grant available to individuals, so workers who might want to go and pursue some enhanced training so they can get reimbursed for that. So those are currently open and will remain open. So please encourage people to consider those. As Christy said, it's been a good opportunity for her organization, and I hope that others can take advantage of that. So lots of grants underway. Please be sure to continue to check on that grant webpage. That is where we post all of the information about upcoming grants or grants that are currently open. Next slide, please. All right, so we talked a lot about the different grant programs. I want to pause and see if anybody has any questions or discussion around these grants, or if you just have any other general questions that you'd like to ask at this point, you're welcome to raise your hand or come off mute. Again, if you're on the phone, you can press *6 to unmute yourself. All right, not hearing any questions. You're also always welcome to just put a question in the chat if that's easier for you. And we have staff that are watching that to be able to answer you through the chat. Next slide. Okay, so in addition to our website, we wanted to remind everybody that we also have a monthly newsletter called the Project Pulse newsletter that goes out to provide updates on our projects. It usually has a little bit of a spotlight or a focus on a particular project category, giving some updates on key projects, usually highlighting either our staff or our stakeholder partners that are working on those projects. We also include all of our upcoming stakeholder engagement opportunities. So that's a really great way to stay informed about upcoming meetings that you may be interested in joining. So we have all of those saved on our website, so you can go and take a look at previous editions, and then you can also sign up so that you can be sure that those come to your email every month. So next slide, related to our newsletter, we'd love to get some feedback about our newsletter. Again, we're really looking for some suggestions and feedback about how things are going and what you would like to see. So if you can take a minute to respond to our poll here. First question is, do you subscribe to the ARPA newsletter? And the answer choices are yes or no. The next question is, if yes, what are your favorite parts? And the options are the project updates, the staff profiles, the other stakeholder profiles, the by the numbers section. If you're not familiar, we usually try to highlight some of our key numbers, whether that be our spending or number of grant programs, things like that. And then finally, the stakeholder engagement information. So that's question 2. And then finally, question 3 is, what other things would you like to see in the newsletter? So if there are other features or information that you feel like would be really important for you to see that you haven't seen yet, please throw those in so that we can get your suggestions. We're always looking for new ideas for how to enhance the newsletter. All right, I'll pause for a second and let you all work through those 3 questions. All right, it looks like the responses are slowing down. Okay. And Jen, are those results being shared? Are we able to share those out to the group? I just wanted to see, maybe we can show people how they're responding. Oh, great. Looks like we are sharing them. Okay. So you can see it looks like about 69% responded yes, that they are subscribed to the newsletter. For those 31%, I highly encourage you to get signed up for that. Favorite parts, it looks like most people say the stakeholder engagement information. So that's great. I'm so glad that's helpful for everybody. We want to get that out to all of you. And then next is the project updates. So that's good. That's the vast majority of the newsletter. So I'm glad that that's helpful for all of you. And then what other things would you like to see? That is a short answer. So it doesn't look like I can see it right now, but we will, always happy to share what we hear from people. So I will pull that down. Thank you, everybody, for your contributions. That's really great. We love to hear from you. And again, please always, as Max had mentioned, we do have an email address that you can always submit questions or feedback to us on our ARPA HCBS website. All right, next slide. Okay, I'm going to move into our other department updates. These are just other things we wanted to be sure, since we had you, we wanted to be sure to give you a quick update on. Next slide, please. Oh, great. So we've got our community first choice update. So I wanted to hand it over to Lana Eggers, who is our manager within our Office of Community Living. And she is going to give an update on where we are in the implementation of what we call CFC. So Lana, go ahead.
Great, thank you, Haley. Appreciate being here today. So I wanted to give a quick update on how we're looking under community first choice. And seeing these slides now, it probably would have been a good idea to reorient everybody to what exactly community first choice is. So I'll do that really briefly. Community first choice is an optional state plan amendment that states can utilize to expand our traditional home and community-based services into our state plan, making waiver services more accessible to more people. So Colorado has been working towards the implementation of community first choice for about 10 years. We're very, very thrilled to get traction on it this year. ARPA funding has really helped us kind of get the boost we needed. We were able to have some staffing paid for through ARPA to support this project prior to budget authority. So it's been really exciting work. The most recent exciting thing that's happened is the passage of Senate Bill 23-289. So what this does is it gives the state the authority to implement community first choice in Colorado. Our partners at CMS and our partners in the Medical Services Board like to know that we have the support of our legislative partners and the state of Colorado as we move forward to implement this program. Additionally, these statute changes were required to make sure that antiquated statute or currently used statute doesn't conflict once community first choice goes live. So an example of that would be something that is currently in the elderly, blind, and disabled waiver. We wouldn't want that to conflict with our new community first choice benefit. So it's confusing or anything like that. So that's why we're doing it. Next slide, please. So the Senate Bill 2389 is pretty broad language, and we did that on purpose because we don't want to pigeonhole ourselves into having really technical language in state statute that makes it less maneuverable going forward. So the Senate bill mimics federal language. So we've taken the required services, we've taken some of our kind of broad overarching themes in terms of eligibility and put those directly in state statute. So we align with what the federal government gives us authority to do. So below here, we mentioned that it defines mandatory services. It talks about how we will have a consumer directed option, and it lets folks know that we also have the authority to implement optional services at state discretion. So we have received some questions from stakeholders on why kind of our whole intended service package isn't in statute. We are still going forward with this robust service package, but we just wanted to be as kind of minimal as possible in statute because it's a little bit easier to navigate. Next slide, please. So just a quick overview, this bill flew through. We introduced it, or they introduced it, not we, I don't do that. They introduced it and we went through committee hearings extremely quickly. So we just wanted to give you a quick rundown of what happened here, just to show the overwhelming support that we did have in the legislature. We passed many of our committees unanimously and just a couple of them with a few no votes. So a lot of support. We expect Governor Polis to sign this bill within the next, I guess, 30 days from when session ended. So we're probably looking at like 21 days from now. And then just a quick shout out, if anybody's on the call, any of these two people wanted to give you a thank you, that Julie Riskin, David Boland, and Megan Bowser all kind of came to action, and they came to testify when we presented this bill or when we spoke on behalf of this bill. So huge shout out to all the stakeholders who have worked with us on this. And I think that might be my last slide. Yeah, that's it.
Thank you so much, Lana. This is such important work, and it's exciting to see things moving along so quickly. So thank you for providing the update. Next slide, we're actually going to turn it over to Jill Schnothorst, who's one of our division directors within the Office of Community Living, and she's going to give us a quick update on the Department of Justice. Jill, are you ready?
I'm
There you
ready. Thanks, Haley. And building on what Lana was saying, because community first choice helps us address the Department of Justice findings that we had. So we are still in negotiations with the Department of Justice, but we did take a very proactive stance on the findings that they issued last March, excuse me, and put forward a budget amendment, BA7 linked here, to move forward some of the initiatives that we wanted to work on to address those findings. That budget amendment was approved through the long bill, and ARPA will be used to pay for the first year of implementation of some of those initiatives. A couple of those initiatives are in-reach counseling, so providing information to members living in nursing facilities on community options, increasing transition coordination units, expanding housing navigation, financial eligibility escalation, and then a few other items. So really looking forward over the next few months to build out stakeholder engagement plans and implementation plans to bring back to you all. And then if we could move to the next slide, trying to be cognizant of time here. I know we're a little over. We have also been working on an equity study through the ARPA 301 initiative, really trying to understand where we have some areas for improvement. We've had one virtual summit to talk about some findings that we've seen through some internal equity studies and surveys, and we're looking to host another one on June 6th. We'd love for all of you to participate in that conversation where we'll really review the equity study and the survey results, and then also have a conversation on what we can do to be better in that area. So again, would invite you all to attend that meeting on June 6th. Please register by the end of this month. And if you want more information about this project, there's a link on this slide as well. And I'll go ahead and hand it to Candace, I think, who's going to round us out.
Thanks, Jill. Yeah, I do think Candace is up, but the webinar goes till 4:30, so we have a little bit of extra time, although maybe some people are ready to get out of here because it is kind of a gloomy day. So I will hand it over to Candace to provide an update on our rates. So Candace.
Thank you, Haley. We're all just so excited that we just flew through this packed agenda. There's just too many exciting announcements. And I am very pleased to announce, and my name is Candace Bailey. I'm the HCBS Division Director within the Office of Community Living. And I get to tell everybody about rate increases, which is awesome. I love telling people about additional money that they get. So this actually came out of this year's legislative session. So this is actually not tied to ARPA, it's just a general update, but it's super important for everybody to realize effective July 1st of 2023, both our group homes, so group residential services and supports within the developmental disabilities waiver, and the non-medical transportation services within the supported living services and the developmental disabilities waivers, both of those services are actually receiving a targeted rate increase that will go into effect on July 1st. So that's really exciting. We know that our group residential services were hit pretty hard by the pandemic and with the workforce issues. So we're really excited to be able to offer a pretty significant bump there. And then the non-medical transportation services, that rate increase was actually intended to bring those rates in alignment with the NMT services that are on the other adult long-term services and supports waiver. So all of those rates should be equal, which is really exciting. Additionally, there was another direct care worker base wage increase. So starting on July 1, we are going to be requiring all of our direct care workers to receive a $15.75 base wage, which will go up from the $15 that is currently in place now. And the services that include those base wages, those services also received the corresponding rate increase to go with that, which is really wonderful that the Joint Budget Committee and the General Assembly is really supporting those wages for our direct care workforce, which are so critical. And then on top of that, and usually this isn't the case, so this is really exciting, is on top of the targeted rate increases and the base wage increases, there's an additional 3% across the board increase for all of our services. So this will be in place for all of Medicaid services, the providers, starting July 1. So this is another really exciting and a huge support from our General Assembly, realizing the needs of these providers and for you all to be able to continue to provide the critical services that you do. All of our rate schedules will be updated, should be, could be anytime in the next couple of weeks. Our rates team is working really hard on it, but it will be up and ready and posted for everybody to view what those new rates are going to be by the beginning of June. So you all can check that out and watch for that. So that information will be available at least a month before those rates go into place. And that is actually the only slide I have. So Haley, I will pass it back over to you.
Great, thank you so much, Candace. Sorry, I had a child coming into my office. So thank you, Candace. Appreciate that update. I know that's really exciting for people to hear about the rate increases that are coming. Always great news. If you can take us to the next slide, Jen. Thank you. All right. So does anybody have any questions or comments about CFC or about the rate increases? Anything else that we've covered? I'll pause for a second and see if anyone wants to come off mute or put a question in the chat. And I did see a question from Carrie. It says, does ARPA cover compression stockings or medical devices? So ARPA HCBS funds cannot, unfortunately, be used to cover expenses that would otherwise be covered from other sources. It's considered supplanting. So if those are things, you know, it depends on what we're talking about, but if there are things that would otherwise be covered by Medicaid, then that would not be something that ARPA could then cover. Otherwise, you know, we need to cover it under one of our 63 projects. So if you have a specific question about a particular medical device or something that you're looking for, if you just want to send that over or submit that in our question box, here's the link. I hope that's the right link. Max, please correct me if I put it the wrong one, but that is a comment form or question form that you can submit questions to. So if you have a specific question about something that you're, oh good, I did it right. Thanks, Max. If you have a specific question, please send it to us and we're happy to address that. But any other questions or comments from the group? All right, next slide, please. All right, we've got one more poll for all of you. Thank you so much for your participation thus far. Great to get some feedback from the group. So we want to hear about our webinars. So we do these on a quarterly basis. And, you know, these are really for our stakeholders to get information and hear about our progress and ask questions. So we wanted to hear from you. What kind of content are you most interested in seeing during our quarterly ARPA webinars? And we have multiple choice options here, including detailed project updates, guest speakers such as grant recipients like we had today, detailed spending updates, mini stakeholder feedbacks gathering sessions for specific projects, or other. So other ideas, you can throw those into question number 2. We'd love to hear if there are things that we haven't actually been providing in webinars thus far that you'd really like to see more of. So if you could respond to that poll, I'll give you a minute to do that. Great. While we're while everyone's working on those poll responses, I see that Tara, you have a question. I will let you ask that either in the chat or you're welcome to come off mute.
Well, I was just doing the math and back to the rate increases. I guess we're going to get a 3% rate increase. And I guess the rate is going up from $15 to $15.75. I pay more than that, but regardless, if the minimum rate goes to pay our DSP goes to $15 to $15.75, that's a 15% increase, or I'm sorry, a 5% increase. But yet our rates are only going up 3%.
So thank you,
So-
Tara. Thank you for that question. The 3% is across the board, and then there's also additional associated rate increases to account for that increase in the base wage. So the 15 to 15.75, there's an additional rate increase for that.
Oh, okay. All right, thank you.
Of course. Thank you for the question.
Thanks, Candace, for jumping in, and Tara for your question. So I believe we're sharing the results, and to our question, it sounds like the detailed project updates are what people really like to see. 75% responded there, and then also some guest speakers and spending updates. So we will continue to do that. Sounds like that's what the group is looking for. So I'm glad that we are focusing on those things, and we'll continue to bring you new content each time we come together. All right. Okay, so in the spirit of continuing to gather feedback and suggestions, as you all remember, we always ask for you to complete our very quick 60-second satisfaction survey that will give us feedback on this particular webinar session and let us know how it went, and if there's anything you'd like to see different next time. So if you can jump in there and respond, that would be great. Next slide, please. And save the date. We do have our next OCL, so Office of Community Living update webinar coming up June 15th. So that is a Thursday. Please mark your calendar from 9:30 to 10:30. Max just put in the link in the chat, a registration link for that. So please go ahead and get yourself registered. We are asking for registrations. That's something new that we're going to be starting. So if you can go ahead and just put your registration information in, it just helps us know how we can tailor the webinar to the individuals who are participating, so that we can make sure that the information is really relevant for you. So really appreciate you going ahead and registering. Make sure that date's on your calendar, June 15th, 9:30 to 10:30. And that'll just be our normal general OCL webinar versus the ARPA focus. Next slide. All right, and that concludes our presentations today. I want to thank all of our many speakers for preparing slides and being willing to speak with the group today, and thank our participants for being here. And please don't forget to complete that survey, and we will see you next month at our Office of Community Living webinar. Have a great day. Thanks, everybody.